Hey, welcome to another episode of Your Faith and Health Community. Your host, Pastor Jackie Jackson. As always, on behalf of myself and our producer, Anita Alexander, we want to thank you for taking out time from your busy day to spend with us. Hopefully, prayerfully, we will give you some information that will improve your quality of life. Now, I told you we were going to be back with Marchelle. You just didn't know it was going to be like right back. But we're here. I'm not even going to go into the health care. I mean, you already know you need the health care insurance. You know, you need to go to Medicaid or to the marketplace, depending on where you are. Because this information is so good and I enjoyed it and learned so much. We're going to jump into it. Next time, though, you know, I'm going to talk about the health insurance. Okay, I just did. But I'm done now. Marchelle, thank you for coming back.
Thank you for having me.
We left off with some very good information, but we didn't get everything that we needed. So I want to jump back in, just to remind people, what is the name of your company?
Opening Doors Disability Service Consultant.
And what do we do it there?
We find services for individuals with disabilities, their family members, their loved ones.
And you are a RNBSN. Did I do that right?
Yes.
Okay, and what is that?
As a registered nurse with a bachelor's degree in the science of nursing.
See, I got the letters right. I wasn't getting ready to try to do the rest of it. I was going to go with that victory and stop. And so your company, how long have your company been around? How long have you been doing this?
7 years.
7 years.
Yes.
So you're getting ready to go. If we go with the Bible, completion of that first 7. So now you're getting ready to go into new beginnings.
Right.
I wonder if that means nationwide. I don't know. I'm just asking
hope
a
so.
question. While we were breaking, you said something to me. You were talking about your daughter, Christina.
Right.
So, you know, before I ask this question or bring up this point you made, tell people who may just be seeing for the first time, tell them about Christina.
Christina is 33 years old, and she was born premature. She weighed 1 pound and 1 ounce when she was born, and she had a lot of health problems. She has hydrocephalus, cerebral palsy, epilepsy, and she's blind. For the first 6 years of her life, they diagnosed her as deaf and blind, and then she started to talk, so.
Surprise.
I know. I called her doctor and said, I think she can hear. And he said, well, what would make you think that? I said, because she can talk. So he was like, well, okay.
You had your very own, remember the movie Look Who's Talking? You had your very own.
I did. It was so amazing. They told me she never walks, sit up, stand up. She walks. She talks selectively. She can do anything you ask her to do, so I'm really pleased with that. She was diagnosed with profound mental retardation, which I hate that word, but she's not profound. She can follow commands, and she can do some things on her own.
Well, one thing that you shared during the break that she can do on her own, that there are a lot of people who are not dealing with the disabilities, have not seemed to manage yet. You told me that Christina is a homeowner. I thought because you are her caregiver or one of her caregivers, I thought she was in your house, that she lived with you. But then you made it clear that she lives down the street.
Right.
So let's talk about Christina, the homeowner.
Okay.
And what that was like to get her to that point.
Okay. I went to the Ohio Department of Developmental Disabilities Council, put on a seminar for home ownership. This was called the Home Ownership. It was just a seminar in Columbus back in 2015, October 18th of 15. And I met a man there who is local who told me how to go about getting Christina her own house. So I followed all the instructions, and she got into her house the very next February. So it took her about 90 days to get into her house after this whole process. So she stayed in that house for 3 years with caregivers. And for 3 years, I wanted Christina enrolled in the Family Self-Sufficiency Program through Cincinnati Metropolitan Housing. I asked them, could Christina become a homeowner? And they told me no. And I said, well, why not? And they said, because she doesn't make enough money. She's only on SSI, which at the time was like $8,088 a year. And they said, you need to make $12,000 a year. And I said, well, she will never make $12,000 a year. She doesn't have the capacity to make $12,000 a year. And they said, well, she can't be a part of the program. I said, well, are you discriminating against her because she can't make $12,000 a year? And the lady said, well, I never thought about that. Maybe we are. And so she went and asked her supervisor, and her supervisor told her to give her the same opportunity that she would give anyone else without a disability. So she did. They filled out this paper. They told me to take it to a place down on Finley called the Smart Money. They ran Christina's credit, and they said, you can start looking for a house today. So
Wow.
all she ever had was a cell phone, gas, electric, and water bill. But she had a good enough credit score to become a homeowner.
Wow.
So
Today, go look today.
Exactly.
All right. Not now, right now.
Right.
All
Yeah,
right.
they said today. So that was July 20th. She found her house on August the 20th. She made an offer on her house. And the day before her 23rd birthday, she closed on her house.
Oh, she got in her house at 23 years old.
23 years old, and she's been in there for 10 years now.
All right. That is a blessing. So, but had you not fought,
Right.
had you not spoken up,
Right.
because sometimes we don't speak up. Sometimes someone says A, B, and C, and we go, okay. And we walk away. And as I said, Christ said, we have not because we ask not.
That's right.
And so sometimes the thing is right there, that thing that we want, whatever it is, the job, the spouse, I don't know, the change is right there, but we never actually ask for it. We talk about what we want, we just don't ask for it.
Right.
And so it seems that what happened here is that you spoke up and was not afraid of the challenge.
Right.
Because sometimes you're going to get pushback at agencies or whatever it is you're doing. And especially what's really rough is sometimes you talk to people who are in positions and they really don't know.
Right.
So they just tell you what they think.
Mm-hmm. That's true.
And it seems like had you not pushed that further and then broke it down to why it wasn't making sense for her to say one thing. And when you told her, well, she will never have the capacity to do the 12,000. She's on SSI. All of this, that was that door opener that made her go ask someone who knew, as opposed to just telling you, no, it's not going to work. Right. So, and it makes you wonder how many other people walked out who could have been homeowners, but either they or no one would speak up for them.
Exactly. I just encountered a client last week with the same problem. She said, well, they told me I can't own a home because I'm disabled. I said, what? Who told you that? People can't, they can't just eliminate you from processes because you have a disability. So I'm going to reference my mother here. My mother told me that the worst thing they could say is no. All they could say is no. And if you don't ask, you'll never know.
Right. Yeah. And no doesn't, it may mess with you a little emotionally, but it doesn't physically hurt you.
Right.
So, and then sometimes you have to take the no for today.
For today.
And then come back tomorrow.
Yeah.
And try to get a yes.
Exactly.
Maybe it was no Monday. So I'm going to go back on Tuesday. Maybe that's there. So your company, do you fight for people?
Exactly.
Exactly like you do for your daughter.
Exactly. I'm an advocacy service. What I do is I look at what your needs are and I help you get them. If they won't give them to you, then I help you fight to get them. And I don't always win, but I can say I got a real good track record. I do have I got lots of successes,
Well, you told us a success story on the other segment. Why don't you give us another one of your success stories?
Okay, I'll give you one. I had a client with 2 children with developmental disabilities, doing it all herself. Single parent, 2 children with disabilities, one with severe behaviors. No one would help, no one would help. I told her, I said, when they're little, no one has to help you because it's then considered a parental obligation. When they are adults, they have to help you because you don't have to do it anymore. So we documented the behaviors. We called the Department of Developmental Disabilities every time there was a problem. There was an elopement, folks running out in the street, getting almost hit by cars. And as a result, that individual gets 24-hour one-on-one care. That's a big success because then that freed up the mother to be able to go to work, that freed up the mother to have a social life, that freed up the mother to just be able to take a breather.
All right, giving mom some freedom, improving her quality of life, then I would assume that that pours over into the care for her loved one, which also improves that quality of life because that continual stress element is removed or at least reduced.
Exactly.
I would think.
Another success story, a mother needed a dwelling for her daughter. They lived in an apartment, which was accessible, but it was overcrowded. And I showed her the process to go through to obtain housing in Hamilton County, because you know that waiting list for Hamilton County has been, for Cincinnati Metropolitan Housing, has been 5 years long for the last 5 years, and it's not moving at all. So we went through a process that created an avenue for her to get housing for her daughter. In fact, she has an appointment to actually receive her voucher on March 2nd. So I'm happy about that.
So more success.
Right.
Well, so let me ask you this. What pitfalls or struggles should new parents or new caregivers prepare for as they get ready to take this walk with their disabled loved one?
Let's talk about people first language.
Okay.
We're going to call them for their loved one with disabilities because it's called people first language. You always put the person first and then you put the disability second. So pitfalls, just the not knowing and people not reaching out. Like you have people in positions, I'm going to tell you this, and this is so true, that if I know something and I call my daughter's support worker and say, I need this for my daughter, if I know how to get it done, it's more likely to happen. But if I don't have a clue, they're going to have to go to work. And if they have to go to work, it's going to get pushed on the back burner. And that's just true with any job. The more work you have to do, the less likely you are to do it. And that's very, very true. So you have to push people. You have to be consistent. You have to do your homework too. You can't just think nobody's going to call you and say, oh, let me help you get help for your child. You know, nobody's going to call you and do that. They're going to be like, I'm not doing that. If she calls, I'll help.
Right.
But the truth is, you have to be diligent in your work too. This is a job. This is a full-time. I don't, you got to make sure you're on top of whatever resources are available. Like if you have a child and your child's getting SSI and they're 18, then know that no one's going to tell you, go apply for food stamps for that child. No one's going to tell you that, but they have an entitlement to food stamps. Okay? No one's going to tell you to go and apply for an apartment for the child, Section 8 for this child. Nobody's going to tell you what to do for that individual unless you do the homework. And then when you get the assignment to do the homework, you really have to do the follow-up.
Well, what is doing homework? Because what does that mean? Because I know when we talked, obviously you're very knowledgeable, but you've had a lot of years experience in doing this, so that means that you've come across the stumbling blocks and the pitfalls, and you've gone up on the mountain and had the success. But what should somebody do to be, and I know you can read, but there's so much information that what do you read? What are you going to go? Where are you going to find out?
I go to the Ohio Administrative Codes and the Ohio Revised Codes that start with 5123. And they are long and they are boring. And they cover a lot. And I read them until I understand them. I'm not a lawyer, but I can read. And sometimes I have to read it over and over and over. The housing laws, I studied them for 18 hours before Christina got her house. Before she had her first appointment, I still had to study after that. Mm-hmm. But before her first appointment, I studied them for 18 hours. And then when I went into her meeting, they said, well, she has to live in this county for a year. I said, no, she doesn't. And they say, well, yes, she does. I said, no, she has a disability. She doesn't have to stay anywhere where you don't provide services. Your closest neurologist is 100 miles away, so she can't live here. And so, you know, you just have to know the rules to the game in order to be able to play. And in order to learn the rules, you have to read them. So, you know, for me as a person, my mother used to teach me, you know, if you want to know something, when you go in these offices and ask for help, you read what they do. And, you know, and I read everything all the time because there's some information in there that's going to be valuable to me or someone else. Mm-hmm. And then I can pass that information on. What I find a lot of times is that people don't want to go up against the fight because they're sitting in rooms with doctors, or they're sitting in rooms with nurses, or they're sitting in rooms with people that they think have more education than them, so they don't want to fight the good fight to get what they need for their loved one.
So the key is educating yourself.
Yes.
You know, because you're right, you can't, boxers, just to use, boxers study film. Football teams, they study film so that they understand their opponent,
right,
and who they're going up against. And whether we like it or not, a lot of times we are going up against the system, so to speak.
Right.
Because although the system is there to help, they're people as well. The system is ran by people, and people have thoughts, and sometimes they have bad days, or you may look like somebody they don't like. And so when you know information, when you can say, like you said, no, she doesn't have to live here. The closest neurologist is 100 miles away, so that's not going to work. Right. But if I don't know that, they go, you can't. And again, somebody just says, okay, and they walk out. So getting the information, learning, reading, knowing what it is.
And follow-up is important. You know, if you let it go, they're going to let it go. The squeaky wheel is going to get the oil. If you say, I need this, you know, I've been calling this one agency all week, and she finally told me yesterday they'll get back with you by tomorrow, okay? Because I need an answer. I can't just let it go. If I let it go, you're going to let it go.
And well, also, if I'm not staying on it, I'm not conveying importance.
Right.
You know, and or sometimes we wait to the extreme last minute, right? And then we want it to happen like that. Right. And sometimes poor planning on someone else's part does not constitute emergency on mine.
Right.
So it's a thing of knowing what you need, and then once you know it, put it in motion, because it may not happen the first time. Right. So if you, I don't know how this goes, but if you know you need a certain treatment for your loved one, you don't want to wait to the last minute. You want to get on it, because there may be some no's or some hurdles that you have to get across. And it sounds like to me that you become an expert at anticipating the hurdles and then getting across them. And so that's one of the things that makes your organization really important, because when you're working with the individuals that you do, you're able to, from your experience, not from the book. Right. Some things are just book. You read, you get the theory, and then you sit down and you try to help people. But when you've actually gone through the pitfalls, when you've actually gone on the mountaintop and you've seen the way up from the bottom up there, that makes a big difference. So people are very, I feel, at least from the time I've spent with you, fortunate that you didn't just get all your information and close it up. This is for me, for my 4 and no more. Right?
Exactly.
But you put it out there. What would you say is probably one of the most encouraging, and this doesn't have to be a success story, but the most encouraging thing that has happened to you in this work that you do, that really gets to you, touches you right here?
When I can bring a group of people together and help them, that's the most touching thing for me. Because, I mean, I could do it on a one-on-one all the time, but when I can get a group and then I can present information that will change lives for families. You know, some of this is being proactive, you know, and proactivity is the most important thing. You don't want to be reactive. You don't want to wait until your kid is 18 or say, for instance, I'm not here tomorrow, forever. Then where's my daughter going to be? In an institution? I don't want that. The whole reason we have, you know, the home care system is to avoid institutional placement because there was so much abuse suffered by these individuals. Did you know about that? There are institutions in upstate New York. There was one institution called Willowbrook. And you heard of Willowbrook. And it was a very abusive institution. The Orient in Ohio was even another one. And what they did was they passed a law, and the law is, it's not a law, but it's a program. It's called Title 19. You know, there's Title 20 for daycare for children under 12, but there's Title 19 for individuals with developmental disabilities that create avenues for them to receive services. Well, that's going to help them avoid institutional placements. But if you are not in an institution and your mama's always been the one that's taking care of you and she passes away, then what's going to happen to you? If you don't have your own home, you're going to go into an institution. Or if someone doesn't take you, you're going to go into an institution. But if you got your own stuff, you know, you can stay where you are. You don't have to change your life. You've already been, I mean, you know, your life has been upset because you just lost someone you really, really know and love. But, you know, you can at least stay where you are. You don't have to go out and find a whole new place to live. So now your whole life has changed. You don't want to do that. So,
God bless the child.
I know.
That's got its own. I want to go back real fast because we're unfortunately running out of time.
Again.
And I started, again, I know, right? It goes real quick. When it's good information, it speeds up. You mentioned people first, disability second. So, and I'm assuming it's that I said it wrong. And so it's just explain that again so that we are correct.
Okay. Well, people first languages, let me give you an example. My disabled daughter. No, I have a daughter with disabilities. So you always put the person first and then you reference the disability. And you don't even have to say what it is. You just say it's a disability.
In order of importance.
Right.
And the person is more important than the disability. And it's also, thanks for the education, it's also honoring. You honor that person and not the disability.
Right.
Okay, I like that. Thank you. Education is important.
It is.
I don't know, maybe I need to take one of your seminars.
Maybe.
Listen, thank you again. I mean, really, I really do thank you. I think we could talk for the next couple of hours and probably wouldn't get to everything because God has blessed you with a lot of information. And, you know, I believe that God, He picks people that He knows will do. I mean, okay, God knows everything, but that He's put in you that you're going to take that information and you're going to use it for His children. So on behalf of everybody, again, that you've worked with, I don't even know them, but still on their behalf, and that you're working with, and especially those who are coming in the future, I'm just going to say thank you again. Thank you for your service in the United States Army.
Thank you.
Thank you for your commitment to your children. Thank you for your commitment to the community, and praying to God for you for much, much success.
Thank you.
So, want to thank you all again. Listen, I know you had to get some information today, somebody, and it was you, whoever you are, some information that's real important and vital. Use it, like she said, don't wait around, don't procrastinate, get the information, study to show yourself approved. Bible says study to show yourself approved unto God, a workman need not be ashamed, rightly dividing the truth. That's for the word. We need to study to show ourselves prepared for the life that we live on this earth and having information. So get your information, stay faithful, stay healthy.
Thank you. It was a pleasure meeting